Welcome to the e-learning module on pathology of tumors of the ovary. In this video, I'll give brief introduction for anatomy of the ovary, including the histology of the ovary, and introduction to the tumors of the ovary. The learning objectives are students should be able to describe the anatomy and histology of the ovary. The contents are covered as anatomy, histology, and brief introduction to tumors of the ovary. Coming to anatomy of the ovary is a paired pelvic organ which is situated on either side of the uterus. The ovaries are attached to the uterus by ligament of ovary and to the lateral pelvic wall by suspensory ligament of the ovary and to the broad ligament by the meso-ovarian. Coming to the development of the ovary. So during around 6 weeks of fetal development, there is migration of the germ cells into the ovarian cortex. So these germ cells are called as oogonia. They will multiply by mitosis and the first stage of meiosis will begin. So by around 7th month of fetal development, these oocytes are surrounded by the follicular cells. So these follicles having central primary oocyte are called as primordial follicles. So once there is primordial follicle formation, there is arrest in first stage of meiotic division. So until the female undergo puberty, there is no further development in the sexual maturity in the ovary. So once the female attains the puberty, in each ovulation cycle, there is activation of around 20 primordial follicles. So this activation will be under the influence of anterior pituitary, which will secrete follicular stimulating hormone and luteinizing hormone, FSH and LH. So once there is stimulation of the primordial follicles, there is stage-wise enlargement of the oocyte and also there is increased number of follicular cell development. So these primordial follicles with increased size of the primary oocyte and increased size of the follicle cells, they are called as early primary follicles. So once there is primary follicle, there is secondary follicle formation where there is still more enlargement of the size of the oocyte and also the size of the follicle cells. So these enlarged follicles are called as granulosa cells. So just before the ovulation, there is completion of first meiotic division. So once there is completion of the first meiotic division, the oocyte is called as secondary oocyte and there is accumulation of the fluid surrounding the oocyte and also a layer of glycoprotein which is called as zona pellucida. So this follicle which is having abundance of fluid and zona pellucida is called as Graafian follicles. So just before ovulation, there is completion of the meiosis. So once there is ovulation, the secondary oocyte with surrounding zona pellucida, which is a glycoprotein matrix surrounding the oocyte, and also corona radiata, which is a granulosa layer of granulosa cells, will be released into the peritoneal cavity adjacent to the fallopian tube. So the fate of these secondary oocyte or the left out granulosa cell. So this is the left out granulosa cell. This is a oocyte with surrounding corona radiata and zona pellucida which is released to the fallopian tube. So fate of these depends on whether there is fertilization happened or not. So if there is fertilization, there is embryo formation. If there is no fertilization, this ovum will undergo degeneration. Whereas this layer of follicular cells, granulosa cells, will get converted into corpus luteum, which will maintain the secretory phase of the endometrium for next few 12 to 14 days of the menstrual cycle. If there is fertilization, this corpus luteum will convert into corpus luteum of pregnancy, which also helps in maintaining the uterus for the fertilization happens. If there is no fertilization, this corpus luteum at the end of the menstrual cycle will undergo involution. So that involuted corpus luteum is called as corpus albicans. This is the histology of ovary showing scanner view of ovarian tissue. This is an oval-shaped organ having outer cortex and central medulla. Cortex has outer epithelium, and inner side there are the gametes, female gametes in various stages of maturation like primary follicles or secondary follicles or Graafian follicle. The medulla is mainly a fibrous connective stroma, and also it is rich in blood vessels. So in this picture, we can see the low power view of the ovary. So this ovary is lined by a germinal epithelium, which is continuity of the peritoneum layer. So within the ovary, in the ovary cortex, we can see the oocyte, which are in various stages. So like primary follicles, secondary follicles, which is large in size and more number of follicle cells are there. And before ovulation, there is formation of Graafian follicle where there is more amount of fluid, and zona pellucida is also present. So with the ovulation, this Graafian follicle having the secondary oocyte and surrounding zona pellucida and corona radiata, which is having the granulosa cells, will be released into the peritoneum. So this is the histology of the ovary. So in histology, there are main three components in the histology. One is epithelium, which is germinal epithelium, continuity of the peritoneum. So in the stroma, you have stromal cells, which are spindle cells, and also the germ cells, which can be having the secondary or primary oocyte. So this is a Graafian follicle which is having an enlarged secondary oocyte surrounded by a zona pellucida and corona radiata. So this is high power view of the Graafian follicle where you are seeing two layers. So the first layer is, the inner layer is granulosa layer and the outer layer is theca layer. So both these layer will produce estrogen and progesterone. Granulosa will produce progesterone and estrogen, whereas theca layer will produce estrogen. So once there is ovulation, the oocyte will be surrounded by the granulosa cells which is released. So this is the picture of corpus luteum, which is having the granulosa, thick layers of granulosa layer. So they have got abundant eosinophilic cytoplasm. These are the theca cells, which are source of estrogen. So if there is no fertilization after ovulation, the corpus luteum will undergo involution. So this involuted corpus luteum is called as corpus albicans, which is a fibrous tissue, and also it will have macrophages. So the ovarian stroma has spindle cells which are fibroblast-like. So some of these cells will be luteinized. That means they have more amount of cytoplasm. Some of them will have morphology of the smooth muscle cells. Some will resemble endometrial stromal cells, and also fat cells and neuroendocrine cells. So the central part of the ovary is called as ovarian medulla, which has hilous cells. So these hilous cells are somewhat similar to the testicular Leydig cells. So Rinke crystalloids can be seen within these hilous cells. So this cell is a hilous cell which is having a crystalloid, orange color crystalloid, which is called as Rinke crystalloid. So both ovulation and ovarian hormone production is controlled by the anterior pituitary. So anterior pituitary will produce gonadotropic hormone, which are called as luteinizing hormone and follicular stimulating hormones. So coming to introduction to ovarian tumor. So most common lesions which are encountered in the ovary are functional cyst or benign cyst. So the neoplastic disorders can be grouped according to the histology. That is three component what we have seen. That is germinal epithelium, which is also called as Mullerian epithelium, germ cells, and sex cord stromal cells. So the three predominant groups of tumors in ovary are epithelial tumors, germ cell tumors, and tumors arising from the sex cord stromal cells. So the predominant group of tumors of ovary will come under surface epithelial tumors, which accounts for around 60 to 70%, followed by 15 to 20% of tumors which are germ cell tumors, 5 to 10% are sex-caused stromal tumors, and 5% can be metastasis to ovary. That is malignant tumor arising from some other tissue which will come and metastasize to the ovary. So to summarize, ovary is a paired pelvic organ which is situated on either side of the uterus. On histology, there are mainly three types of cells: the germinal epithelium cells, stromal or sex-caused stromal cells, and germ cells. These are the references. Thank you.